Hello all, this is Chapter 19, Clients with Nutritional and Metabolic Concerns, Part 3. The obesity paradox is a term used to describe the seemingly contradictory observation that in certain medical conditions being overweight or obese is associated with better outcomes or lower mortality rates compared to being of normal weight or underweight. This paradox has been observed in various chronic conditions such as heart failure, chronic kidney diseases, and certain types of cancer. While the obesity paradox may appear counterintuitive, several theories have been proposed to explain this phenomenon. Obesity is associated with higher energy stores and increased metabolic reserve, which may provide a protective effect during periods of illness or stress. The extra body fat can serve as an energy source during periods of reduced food intake or increased energy demands. Obese individuals often have a higher body mass index, or BMI, which can be a better indicator of better overall nutritional status. Adequate nutritional reserves may contribute to better outcomes in individuals with chronic diseases. In certain cardiovascular conditions like heart failure, obesity may offer some protective effects. Increased body weight can provide a cushioning effect and offer protection to the heart during stress. Additionally, obese individuals may have higher levels of circulating lipids, which can have cardioprotective effects. Reverse causality and selection bias may also contribute to the obesity paradox. In some cases, unintentional weight loss due to underlying health conditions may lead to a lower BMI, which could be associated with worse outcomes. Additionally, individuals who are underweight or of normal weight may have other comorbidities or factors that contribute to their increased mortality risk. It's important to note that the obesity paradox is not universally observed across all medical conditions, and the relationship between obesity and health outcomes is complex and context dependent. Obesity itself is associated with an increased risk of developing several chronic diseases such as type 2 diabetes, cardiovascular disease, and certain types of cancer. Therefore, it's crucial to prioritize weight management and adopt a healthy lifestyle to reduce the overall risk of obesity-related health complications. Further research is needed to fully understand the mechanisms behind the obesity paradox and to determine the appropriate clinical implications. Healthcare professionals should assess each individual's unique situation, consider multiple factors, and provide personalized recommendations for management and overall health. Hyperlipidemia is often seen in individuals who are obese or overweight, and it can contribute to the increased risk of cardiovascular disease in this population. Here's some key points regarding hyperlipidemia in individuals who are obese or overweight. Obesity is commonly associated with specific dyslipidemia patterns characterized by elevated levels of total cholesterol, LDL, and triglycerides, as well as reduced levels of HDL, which is the good cholesterol. These lipid abnormalities are commonly observed in individuals with central obesity or excess fat around the waist and insulin resistance. Obesity is closely linked to insulin resistance, a condition in which the body's cells become less responsive to the hormone insulin. Insulin resistance can lead to dyslipidemia by promoting the production of triglycerides and reducing the breakdown of LDL, which is the bad cholesterol. Adipose tissue or body fat plays a crucial role in lipid metabolism. In obesity, adipose tissue becomes dysfunctional, leading to increased levels or release of free fatty acids and inflammatory factors. This can disrupt lipid metabolism, can contribute to elevated lipid levels in the bloodstream. Obesity is associated with increased production of very low density lipoproteins, or VLDL, which are responsible for transporting triglycerides in the bloodstream. Elevated VLDL levels contribute to elevated triglyceride levels and can lead to the formation of small, dense LDL particles, which are both atherogenic, which promote plaque formation in arteries. Obesity is often accompanied by reduced levels of HDL, which is considered cardioprotective. Low HDL levels are associated with an increased risk of cardiovascular disease. Weight loss and lifestyle modifications are crucial for managing hyperlipidemia in individuals who are obese or overweight. A combination of dietary changes, regular physical activity, and weight loss can help improve lipid profiles by reducing total cholesterol, LDL, and triglyceride levels, and increasing HDL levels. In some cases, lifestyle modifications alone may not be sufficient to manage hyperlipidemia in individuals with obesity. In such cases, healthcare professionals may consider prescribing lipid-lowering medications such as statins, fibrates, or other lipid-lowering agents to help control lipid levels and reduce cardiovascular risk. It's important for individuals who are obese or overweight and have hyperlipidemia to work closely with their healthcare professionals to develop a comprehensive treatment plan. This may involve regular monitoring of lipid levels, adherence to a heart-healthy diet, engagement in regular physical activity, and if necessary, the appropriate use of medication. This is a table that discusses the possible causes of and treatment strategies for unfavorable lipid levels. When designing an exercise program for clients with hyperlipidemia, it's important to consider the unique needs and underlying medical conditions. Here are some key points to consider when prescribing exercises for individuals with hyperlipidemia. Aerobic exercises such as brisk walking, cycling, swimming, or jogging can help improve cardiovascular health and lower lipid levels. Aim for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise per week, spreading out over several sessions. Gradually increase the intensity and duration of aerobic exercise over time to achieve cardiovascular benefits. High-intensity interval training can be considered for clients who are capable of engaging in vigorous exercise. HIIT involves alternating periods of high-intensity exercise with periods of low-intensity recovery. It has shown beneficial effects on lipid profiles. Incorporate resistance training exercises to improve muscle strength and overall fitness. Include exercises targeting major muscle groups such as squats, lunges, chest presses, rows, and shoulder presses. Perform 2 to 3 sessions of resistance training per week, allowing for adequate recovery between sessions. Include stretching exercises to maintain or improve flexibility and stretch major muscle groups after the aerobic and resistance training components of the workout. Focus on static stretching and holding stretch for 15 to 30 seconds. Ensure proper warm-up and cool-down periods to prevent injuries and improve circulation. And monitor exercise intensity using perceived exertion or heart rate monitoring if appropriate. Encourage clients to listen to their bodies and modify exercises needed to avoid overexertion and discomfort. Encourage clients to adopt a healthy lifestyle, including a well-balanced diet, weight management if applicable, smoking cessation, and stress reduction techniques. Emphasize the importance of regular physical activity as part of a comprehensive approach to managing hyperlipidemia. Clients with hyperlipidemia should consult with their healthcare provider before starting an exercise program. Monitor their lipid levels regularly to assess the effectiveness of lifestyle modifications, including exercise. And remember, individual variations exist, and it's essential to tailor exercise programs to each client's specific needs and abilities. Metabolic syndrome refers to a cluster of interconnected metabolic risk factors that occur together and increase the risk of cardiovascular disease, type 2 diabetes, and other health conditions. These risk factors include obesity or excess abdominal fat, having a waist circumference greater than 40 inches for men or 35 inches for women as a common characteristic of metabolic syndrome. Insulin is a hormone that regulates blood sugar levels. In insulin resistance, cells become less responsive to insulin, leading to elevated blood glucose levels. Blood pressure equal to or greater than 130/85 is a defining criterion for metabolic syndrome. Hypertension increases the risk of heart disease and stroke. Dyslipidemia refers to an abnormal level of blood lipids, including high triglycerides above 150 milligrams per deciliter, low levels of high-density lipoprotein cholesterol, below 40 milligrams of deciliter in men and 50 milligrams of deciliter in women, and elevated levels of low-density lipoprotein above 130. Elevated blood sugar, fasting blood sugar. Fasting blood sugars levels equal to or greater than 100 milligrams per deciliter indicate impaired glucose regulation and an increased risk of developing type 2 diabetes. The presence of 3 or more of these risk factors qualifies an individual for a diagnosis of metabolic syndrome. It is important to note that the exact criteria and thresholds for diagnosing metabolic syndrome may vary slightly depending on the organization or guidelines used. Causes and risk factors. Metabolic syndrome is closely linked to lifestyle factors, including poor diet, a diet high in processed foods, added sugars, unhealthy fats, and low in fruits and vegetables and whole grains increases the risk of metabolic syndrome. Lack of regular physical activity and a sedentary lifestyle contributes to obesity, insulin resistance, and other metabolic abnormalities. Certain genetic factors can predispose individuals to develop metabolic syndrome. The risk of metabolic syndrome increases with age. Hormonal changes, particularly in women after menopause, can contribute to abdominal obesity and insulin resistance. The management and prevention of metabolic syndrome typically involves lifestyle modifications, healthy eating, so adopting a balanced nutrient-rich diet that emphasizes whole foods, fruits, vegetables, lean proteins, whole grains, and healthy fats can help improve metabolic parameters. Engaging in regular physical activity, including aerobic exercises and strength training, can help improve insulin sensitivity, reduce abdominal fat, and improve lipid profiles. Achieving and maintaining a healthy weight is crucial in managing metabolic syndrome. Weight loss through a combination of healthy eating and physical activity can significantly improve metabolic parameters. Managing blood pressure through lifestyle modifications such as reducing sodium intake and engaging in regular exercise, and if necessary, taking prescribed medications is important. Managing blood sugar levels through a diet, physical activity, and if necessary, medication can help prevent the development of diabetes in individuals with metabolic syndrome. Quitting smoking is vital for reducing the risk of cardiovascular disease and improving overall health. Regular medical checkups and monitoring of blood sugar, blood pressure, and lipid levels are important to assess progress and make any necessary adjustments to the treatment plan. It's important for individuals with metabolic syndrome to work closely with their healthcare professionals, including physicians, dietitians, and exercise specialists, to develop a personalized management plan that addresses their specific needs. And that is all that I have for you today. I look forward to talking with you again. Talk to you soon.